So our next speaker is Cecilia Moe, who is an associate professor of political science here at UC Berkeley.
Thank you. This is joint work with Katrina Kosick at IFPRI and Johns Hopkins. She's the economist and I'm the political scientist. So kind of going at it with two perspectives. So our broader question was, why might citizens fail to reward policymakers for providing targeted social protection? And we were wondering if perceptions of inequality might actually moderate the relationship between social protection and political support. Now, in terms of the motivation, we are recognizing that there's an economic trend where inequality across countries, while it's declining, that there's simultaneously an increase in income inequality within countries and just a growing sort of perception that inequality is an issue. And in terms of a political trend, governments are increasingly addressing poverty through social protection programs like cash transfer programs. And I know there's a number of projects that were being presented today that are talking about means-tested cash transfer programs. When we're looking at general body of research around what does that translate to in terms of support for the institutions that then provide these programs, we're seeing a mixed literature here, where some say that that translates to sort of rewards for the incumbent in terms of extra, like, added vote choice. And then there's others that say actually it doesn't really have much of an effect, so that it's not really translating to any sort of political rewards. So we said, positive, negative. And when we're looking at what we might expect, classic economic voting theory would basically say citizens should reward the government for good economic outcomes and punish it for bad ones, right? And when we are thinking about existing explanations for why there might be mixed findings, they largely fall under sort of three categories. First might be attribution challenges, not quite knowing who to actually reward, right? Thinking like, oh, it might be my local government instead of recognizing it's the federal government or vice versa. That there might be views of partisan targeting, that the policy might be viewed as something very political, that certain kinds of individuals are getting the goodies over others. And then there's others that sort of speak to how timing and duration might matter. There might be like a short-term bump, but then if you ask folks like 1 or 2 years later, that it's really not durable, right? So we're introducing a fourth kind of consideration that has to do with perceptions of your relative position, and that has to do with reference points, and thinking that your view of where you are in the income distribution might affect how you view your results. And we're arguing that citizens' perceptions of their relative economic position is really going to moderate, such that when feelings of relative deprivation aren't particularly acute, you might not see long-term differences between beneficiaries and non-beneficiaries. But when perceptions of inequality is high, you're going to see non-beneficiaries being more disgruntled and beneficiaries perhaps being more appreciative. And so you might actually see a larger difference between beneficiaries and non-beneficiaries. So to do our study, we are leveraging the Benazir Income Support Program, one of the largest unconditional cash transfer programs in the world, which started back in 2010, so it's been around for a little over a decade. And importantly, they use a wealth score to distribute transfers. So we leveraged this data and married this with data that we collected back in 2013, the Pakistan Rural Household Panel Survey, where we ask a set of questions around political attitudes. And then we also, in a moment I'll show you, we layer in an experiment to manipulate views of inequality, or perceptions of inequality. The survey is representative of rural areas, so you can see that the communities that we're targeting in those little triangles. But we are not trying to target all of Pakistan because due to security reasons and not wanting our enumerators to be endangered, there were just some parts of the country that we were not willing to send our research team to. So it's representative of a set of rural communities in Pakistan. So as I said, the wealth score, there was a threshold for when you were qualifying for the program. So we leveraged that to do a regression discontinuity design. But it's a fuzzy design because there was sort of a score in which you might be able to appeal based upon other conditions that you might have in your household. Like if you can show that there's a disabled member in your household, you might be able to qualify to receive the program even though your wealth score is a little bit higher. Right, so then when we look at the first stage to see if the wealth score was really being used in the way that it was intended, we do in fact see that there's a robust first stage. So we can go forward with our design. We see in terms of just checking whether or not we can use this design, we see that there's pretreatment characteristic balance right at that threshold, so we proceed. In terms of the experiment, we didn't want to provide long-term effects in terms of making people feel that they were relatively poor. So we did something subtle. We basically just sort of asked an income question, like a household income question. But for a set of households, we gave them income buckets where they're more likely to pick the bottom income bucket. And another set, they're more likely to pick the middle income bucket, right? So this is just manipulating what response options they had and having it such that the control group is more likely to pick sort of middle or a higher income brackets, and that the treated group would be picking sort of the lowest income bucket. And then we had a series of political attitude questions that we basically drew from like the world value surveys and other barometers so that we can sort of compare that. But the core outcome we'll use as an index of just 7 questions as they were highly correlated. Generally, we saw that this cash transfer program really did do big things, right? So when we're looking at things like total food expenditure, we're seeing over like 2,600 more rupees per month in terms of food expenditure. So there was, in fact, a meaningful economic impact of having this cash transfer program. It wasn't a trivial drop in the bucket. And then when we're looking at just overall, that we see an 8 percentage point bump in support for government right at that threshold, but this is 50% treated, 50% untreated, as it relates to that relative deprivation prime. So when we separate the groups into those who were made to feel that they were relatively poor versus those that weren't, we see that all of the effect is actually being driven by those who received that poverty prime, a feeling that they were relatively low in the income distribution. There's basically nothing going on in the group that wasn't made to feel relatively poor. And when we're looking at whether or not our manipulation was sort of working as intended, we had a pre-treatment question that basically asked, where do you think you fall in the income distribution, right? Because our treatment should really only impact those people who didn't feel relatively poor to begin with, right? If you felt poor, just telling you, hey, you're poor, doesn't really do anything, right? And so we see amongst those who were treated, all of the effect is really happening among the people, like 23.9 percentage point versus negative 0.047, that was happening amongst the people who didn't think they were relatively poor to begin with, showcasing that sort of feeling relatively poor can really affect how you are perceiving the government assistance that you are or are not receiving. And in terms of how this is shifting, when we're looking at to the left of the cutoff and to the right of the cutoff, we're seeing that more of the change is actually happening amongst the non-beneficiaries. So more of that gap between the beneficiaries and the non-beneficiaries, like the treatment effect, is really driven by the non-beneficiaries feeling more upset that they did not receive the program in this time of relative need. So sort of kind of brings to bear the importance of not viewing the control group as truly a control group, as when you're thinking of things like cash transfer programs, there's a set of people given limited resources that feel that they are deserving of assistance, that really need that assistance, but yet aren't receiving that assistance. So I will end there. Thank you.
Any questions? Great, we can wrap it into the Q&A later.